John Lynn.
I have a motion. Do I have a second?
Second.
All in favor?
Aye.
Motion passes. Do I have a motion for vice president?
I move for Betsy Lindeman.
I have a motion. Do I have a second?
Second.
All in favor?
Aye.
Motion passes.
How's it going?
Back.
Okay. All right, next item on our agenda is the adoption of the agenda. So everybody hopefully has had a chance to see the agenda, and this time entertain a motion to approve.
I make a motion to approve the agenda.
Second.
All right, we have a motion and a second. Any further discussion on the agenda? Hearing none, all those in favor, please say aye.
Aye.
Opposed, nay. All right, motion carries. Next item on the agenda is the approval of the minutes from our December 18th, 2024 meeting. Hopefully everybody's had a chance to review the minutes, and
I move to approve the minutes of
Second.
the December 18th meeting. Sorry.
Second.
we have a motion and a second. Any further discussion on the minutes? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, board president announcements. I have nothing to add at this time, so everything's going great, right? Next item on the agenda, health officer presentation and report. Dr. Migliori, turn it over to you.
Thank you. I just want to bring a few items to your attention. There's a few corrections in our packet. The first one is in the Environmental Health Department's report on page 13, under residential replacement, item A, inspections. There was a transposition of numbers. I had read there in the third box down. It says 176. That should be 716. So it was just a transposition of numbers. The next correction is on, it's not very well numbered, I don't think, but it's in the food services report. So it's right after the Nacho Mentor Program. The closest number page to it, it's after the budget. So 18 is the last page number, then you get into the budget. And then you see Nacho Mentor Program. The next page says food services at the top. And it's again, just a typo. The pool complaints and pool closings at the bottom should both be negative numbers. So negative 66.7% and negative 26.8%. Again, the closest page number, maybe page 20, where the lead unit is, and it's the page prior to that. If you see 20 on the left-hand bottom of the page. So those are a couple of corrections there. The last item that or two more items I wanted to bring to your attention on the budget. There were some questions about zeros that were in red versus zeros that were in black. And it's just a programming error. There's no difference between the red zeros and the black zeros. Zeros are zeros. And the last item involves the St. Joseph County Department of Health supplement to the county handbook. And you hopefully got these in your packet today. One is the red line version to see what was changed. And that is the one that has the gray on the front. So those are the changes that were made. And then the final version is the other pack that you received in your packet today, just so you can compare them side by side if you'd like. Things are going great in the health department. The teams are working hard. This month is Radon month. And so the environmental team is working on getting the word out about our free testing kit program. They did, Jessica in the Environmental Health Today did a spot for a couple of TV stations. She did a great job presenting it and explaining it. Get the word out that we have the free radon testing kits. They're very easy to use. You can pick them up here in the health department for anybody who lives in St. Joseph County. So please take advantage and get the word out about that. Remember that we believe that 1 in 4 homes in St. Joseph County will test positive for elevated radon level, which is anything above 4 picoliters or picocuries rather per picoliter. And you have a question, don't you, Kristen?
So before, when we had talked about it, there was a limited number of tests. Is that still true?
The good news is that was for the pilot program. We had 250 tests. And now with the new year comes the new program. And so they've ordered a lot more tests. I don't know, Mark, am I missing anything that you want to say?
Budgeted for 25 test kits.
Great.
So get the word out. Radon is the leading cause of lung cancer in non-smokers. I just read an article that came out last week on the 10th that they are finding that elevated radon can cause gestational diabetes as well in pregnant women. So
Can I ask a quick question?
sure,
How often should that be repeated?
every 2 years.
Okay.
Whether you have a remediation system or not, because the remediation system, you may find that it's not working properly, or it's lost its suction, or the fan isn't working properly. The fan runs all the time, so. But environmental health can get you set up.
What are we
Thank you.
doing to get the word out about this?
So
program?
Media Blitz, social media, we have on our Facebook, the Department of Health website Facebook page. We have a instructional on how to do the actual testing, but we have it on social media, and we have contact with a couple of people getting it out in the print as well.
Great. Mark, did you have something you wanted to add?
Well, also worked out with all the St. Joe County Library system, so we have test kits at every St. Joe County library. We have a doctor's office in New Carlisle, so we're looking for community partners to help us get these test kits out there.
Okay, great.
Spread the word.
Yep.
Thank you.
Tomorrow tour remediation, we're gonna film that and then try to kind of combine that with what we already have to create a longer video, and then post that as well to share. The end of the month is also Radon Awareness Week, so another media blitz and social media campaign around that as well.
Okay, great. Thank you.
Love that.
It's important. It's something that needs to be done. The national average for elevated radon in dwellings is 1 in 15, and in Indiana, it's 1 in 4. So we're above average.
Not where we want to be above average.
No, we don't want to be above average.
Good one.
Are there any questions about anything that you found in the packet that you needed clarified?
Ellen were here. She'd have questions.
I know.
She's online.
So I was wondering if I can put Renata or Alyssa on the spot. Just Ellen did have a question, so I'm serving as her medium for this question about the CHW program I spoke to you about. Specifically, she was looking on the communication on community access resources and education, the care page, which is the second page after the cover page for the packet. Not numbered, but it's this page. You can see it. Do you have it?
I haven't.
Okay. Do you mind explaining the numbers in the fourth quarter, the numbers it looks like they had dropped, and also do you expect that the SNAs, the social needs assessments, will level off eventually? I think those were some of her main questions.
Okay, Renata Williams, Director of Care Unit, trying to get better at doing that when I address So the numbers were down this quarter due to a couple of things. One is a number of our community partner sites were closed around the holidays, Thanksgiving, the middle of December. Also, we were down a couple of CHWs. And then from Q3 to Q4, if you see the amount of SNAs that we received, a lot of the staff was burnt out. So they took vacation also. So we were down CHWs. We had quite a few CHWs on vacation as well. And then in addition to that, in Q3, we saw a lot of SNAs from one of our particular partners that were duplicating service. They were referring community members to us for a service that they provide. So about probably roughly 80 to 100 SNAs we received from them. Some of them we could have helped, but others they could have helped. So we had to have a meeting with them to make sure our process was streamlined, and they had some new staff, so they understand we don't have any additional resources. We refer to the same partners, but we can do these things. And if they need help with this and you provide that service, then you can take care of them. So that was another thing. Also, we're looking at a point where with our our advertising campaign through Force 5, some of the SNAs that we received online kind of dropped in December too. Some of the feedback was that there was a lot of sickness. There's not as many people out in the community looking for service right now. Also, there's other agencies that are providing a lot of resources for like during the holidays. So your Toys for Tots, the Croc Center, they were accessing those other services during that time. And then to answer the other question about if they may level off as far as the SNAs, it very may well level off, especially as we are in the community more. But we have other partnerships that we have identified for 2025. So maybe not. We'll just see.
Okay, thank you.
Any other questions?
Any other questions from the board? Hearing none, entertain a motion to approve the health officer's report.
I motion to approve the health officer's report.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, say nay. All right, motion carries. Thank you. Next section on the agenda, new business. First item 25-02, discussion and vote 2025 budgets.
For the first item, we are requesting to have this removed from the agenda at this time.
These are all under one item, so it'll just be one vote, Marcel? Yeah.
25-02.
Well, we want to move forward with the other item, so.
Yes, please.
So,
So table 25-02, local public health services,
okay,
and move forward with the rest.
then we got a motion to table item 25-02, 2025 budget, local public health services.
So moved.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, say nay. That motion carries. Continuing on with that item, 25-02, 2025 budgets. Countywide lead initiative, high school liaison, health. Local health services, health trust fund, Nacho mentor program.
Okay. Renata Williams, Director of Care. We are looking to appropriate the funds for the countywide lead initiative for 2025 for salary for the CHWs.
I make a motion to approve the countywide lead initiative budget.
Second.
We have a motion and a second to approve the countywide lead initiative budget. Any further discussion? Or questions? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. So we're gonna do these one at a time. Is that in preference of the board? One, yeah, okay. 2025 budget, health school liaison.
Hi, Ashley Hellman, Director of Nursing. It's for the school health liaison role, and I'm going to give you a little bit of information about what we did with that role this year since it was new in March of 2024. So over the course of the year, we launched multiple initiatives and provided support to school staff and students in our county. We visited schools and did in-person assessments, created methods for schools to request health-related supplies. We created and launched a community partnership program to connect community support to school needs throughout the county. We held our very first school health conference for all school health personnel. And due to the success of that conference, we were asked to present to other counties across the state regarding the program. We were hands-on in schools doing things such as providing education on vaping, Narcan training, participating in wellness committees in schools and in districts, and completing things like vision screenings. Since September 1st of this school year, we have had over 120 contacts from schools asking for non-physical resources, so questions about immunizations, illness, community partners, lice, bed bugs, and more. We communicate with our schools monthly, and we have a live Zoom meeting options to connect real time. Looking then ahead to the new year, the budget, much of the budget is the staffing cost for the liaison position. But there are a few items on the budget that I'd like to talk a little bit more about in detail. The conference item allows for that school health conference to be held again this fall. Last year, we had an attendance of 42 school health personnel, and we are hoping to increase that by 50%. That funding also covers the cost for the liaison to attend trainings, to increase their ability to provide programming in schools such as Stop the Bleed, CPR, et cetera, and to continue learning. There's also a large amount in the medical supplies, and that is, the number came from taking the average of what we spent monthly on requests from schools, and we forecast the potential costs for the upcoming year. And I want to emphasize that when we receive requests, we review those requests with a team. That includes multiple people from our department. We make sure that there is an overall need, and then we do our very best to find the item for the lowest cost possible. This school year, we've purchased things such as testing equipment, hearing machines, blood pressure cuffs, thermometers, pulse oximeters, durable equipment such as transport chairs, nursing office furniture, emergency supplies. AEDs are a frequent ask, and then some single-use items. So it's information that you guys have heard and are familiar with, but I'd be happy to clarify any details you have or answer any questions about specifics.
Any questions, please?
So last year, we had a grant that we divvied out to the different schools. Did all the schools actually capitalize on that?
So they're still utilizing that grant funding, and we are filling those requests daily. So Amy is busy with those, and we have reached out to all of our schools. So the nurses on our team reached out today, finished contacting schools who haven't responded, either by asking for a request or connecting with us for another need, and making sure that they knew about the school liaison and that there hadn't been staffing change, that they knew that that special funding was available. So we're doing everything we can to make sure that people utilize that to its fullest.
So some of this budget amount is going to ideally continue what we started with that, right? Is that what-
Yes, so that is actually part, it goes with our community partnership program, and those are items that are typically donated by community members. When we spend funding, it's typically on health-related supplies, so we try to make sure that if we can provide feminine hygiene products, underpants and clothing through community support, because we do have a very generous community, that we use our funds to the best of our ability and focus our spending on things that are a lot harder to get through a donation.
Please.
Couple questions. One, the donations are $50,000. Is that from our local health systems?
No, so that $50,000 donation was a special donation by the Barb and John Fair Foundation. When they heard about our community partnership program in August of this year, they were so excited that they wanted to make sure that every school in our county had $500 to be able to request $500 worth of items from that program. And so that's what that $50,000 is.
Second question is each hospital system has a community tithing fund that they are required by their policies and standards to give back to the community. Have we reached out to them for anything in a recent past that would enhance more funds available for the categories that you've designed here?
That is a great question. We have typically seen the opposite with our, for nurses in most of the school districts in our county. They are employed by the major health systems. So Beacon and St. Joe support the schools by, they employ the nurses, the health aides, and anybody that will be in the building providing health care. We have worked with them in the past. They have asked for funding from us to help support their initiatives. And that is something that we have completed and we're not doing going forward just because there are other options for them funding wise. And again, we want to make sure that the funding is going to the places where it's most needed. And we have some idea of where that is.
Other item is, we have 5, 6 public school systems, 40 or so parochial private schools. It seems like an enormous task for one liaison person. I think I would hope that we would be able to increase the number of school liaison officers or people over time. Maybe we go try to find some other avenues of funding for that, but it just seems like an enormous task for one person to coordinate all of those efforts for so many kids. You know, it's over 50,000 kids in our community, and so that's a lot to ask of one person.
I like the way you think. We have been discussing that and we have 100 schools in our county. It's a lot of schools, a lot of children. We're one of the larger counties with a school liaison. Many of the counties that have a school liaison program have 2, 3 or more. And so hopefully we'll be able to look at that going forward and scale it appropriately. But how we've done it so far is that we have only taken on the tasks that we can do with one person, and then we will hopefully be able to increase our reach if we could increase staffing.
Are we doing any tracking measures to show like what we're doing is affecting this and how it's a positive, just as statistically to be like, this is where our money is going and this is what it's saving health wise and all the things.
So we do have a Red Cat form where we're asking schools to keep track of the amount of time saved by the supplies that we provide in the classroom or in the schools. And we hope to use that to be able to see that it's worth the cost and effort that is going into the supplies that we're providing. We rolled that out in December of this year or of last year. And so we don't have a lot of data on that yet, but that's something that we are looking at because we do want to know that this is making an actual difference. And if we're not seeing the return, that we change our efforts and make sure and use them towards something that will receive a return.
Right, because I agree,
Mhm.
like that's, and there's no way one person can do, whoo, here we go. No, but, if we're spending almost $400,000, we need to make sure it's money well spent for actually improving the health of our community. And then I wondered, so in what the request is, there's like 200,000 for supplies. What was it prior? Like, have we raised that? Like, I don't have the other data from last year.
So previously, this wasn't a full-time role, but it was funded by the school liaison grant, which was a 3-year grant, which I believe we got, Amy can say the exact amount. But yes, so this is not, yes. Yes. Mhm. Mhm.
Okay, oh, okay, so we didn't use all that.
No,
Okay, I was thinking we're only asking for 200, but we need 5. Okay, that makes.
any other questions?
Mr. President, we have a little experience in this, working with Connect, which some of you may remember some time ago, that established school health partnerships with all of the public schools, parochial schools, which resulted in everything from family resource centers to increased opportunities for vaccinations and all kinds of things. I would be happy to meet with Dr. Migliori and her staff and share what our experiences were to see if they may help expand our reach and expand our ability to attract more financial support. This is certainly appreciated, but just a fraction of what is needed. So if we are to truly invest in our community, it starts with kids and families, and that's really where it needs to be. So we have a long history of this, so I'd be happy to meet at your opportunity, and I'm fairly well free, so we can do that as early as you like, so. That's all I have.
Well said. Thank you.
One more question, sorry. And
Uh-huh.
health starts at home, you're right. The schools prior, you'd had some holdouts that were just like they thought we were trying to do something bad, I guess. Do you feel like you've been able to connect with some of those schools where they're not scared of us anymore, I guess? or-
Yes.
Okay.
I think over time, them seeing what we were doing, that we're not asking a lot back from them, that we really are trying to offer support where needed. We've proven that again and again, and that has allowed them to be more comfortable. And we've had a huge turnaround in the last 60 days or so.
Okay, yay,
Mhm.
good. Fabulous.
Any other questions? Well, thank you. Hearing none, can we get a motion to approve the health school liaison budget for 2025?
Some of.
We have a motion. Do we have a second?
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item is the local health services budget.
Good afternoon, evening. The local health services budget for this year is a legacy fund that we are looking to use up, and we want to allocate those funds towards the Vector program. Predominantly, this will be going towards the Vector coordinator salary and other benefits.
All right, thank you. Any questions or comments? Brett?
I make a motion to approve the budget for the local health services.
Thank you. Do we have a second?
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next budget item, the Health Trust Fund. 2025.
Hello again.
Hello.
This is another legacy account that we are looking to zero out. This would go towards the remainder of the coordinator salary and benefits, as well as funding the split Vector EHS, the part-time position, and other aspects of the Vector program.
Is the information technology and equipment, is that some new fun stuff that you're getting or no? The very last two item lines.
Equipment possibly, maybe updating some of our application equipment. I'm still using some of the stuff that was left over from like 2004 for some of our applicators. And so upgrading some of that might be in the equipment. As far as information technology, that'll also probably be part of our software that we use for the Vector program to track all of our trappings and treatments.
Like just a better program.
Yeah.
Good.
I was also curious, a couple lines up from that, just Vector for 25,000. What can you expand on that a little?
Yeah, that's kind of our general operating expenses. The largest expense that comes out of there is the chemical that is applied throughout the year. The adulticide that is used for the truck mounted sprayer is not cheap, or at least the stuff that I prefer to use that is a little nicer on the environment and more beneficial toward the bees. I would rather use that than just the cheapest stuff I can get off the shelf. But between that and the various different larvicides, that makes up the majority of the budget. The larviciding program does work and greatly reduces numbers and reduces overall sprayings.
Chemical supplies, basically.
And
Essentially, yes.
I read, it must have been something from you. It was talking about larvicide and like where you shift your focus in the winter and all that stuff. So do you see trying to, because you had mentioned it'd be better to like push the larvicide, right? Is that what you said?
Yes.
Is that, do you think that's overall going to help if down the road, you said, I think we should larvicide push, but that's included in all this budget stuff as well? Like that's not an extra
No,
expense?
yeah, that's part of this. Yeah.
It's just shifting where you put it in
Yeah.
the season.
Yep, where I'm at in the season, doing targeted larviciding can reduce the overall mosquito populations in certain areas. I've got a couple of spots that were really stubborn for West Nile. Some of them are in some of our census tracts that do have our most senior residents, and which is a very high risk factor. So doing these larvicidings early in the season and interrupting the population expansion does work, and that is already factored into this budget.
All right, thank you. Any other questions for Brett? Hearing none, I'll entertain a motion.
I move to accept the Health Trust Fund budget as presented.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you.
Thank you.
Next item on the agenda is the NACCHO Mentor Program, 2025 budget.
Yes, this is funding from the Nature Mentor Grant that expired in July in 2023. We have hired a health promotion specialist that started in August, who has been working, focusing specifically on mental health and substance abuse education, stigma reduction. So we would like to appropriate these funds to spend down and complete the purchase of the boxes and the supplies that she needs to spend down the rest of this money.
Thank you. Any questions?
Make a motion to approve the Nacho Mentor Program.
We have a motion. Do we have a second?
Second.
Motion and a second. Any further discussion? Any questions? Hearing none. All those in favor, please say aye. Opposed, same, say nay. Motion carries. Thank you. Next item on the agenda. Item 25-03, discussion and vote, St. Joe County Health Department Health Supplement to the St. Joe County, Indiana Handbook.
The most recent amendments to the supplement are in front of you. They were not sent out in the packets because I got them to Jenny too late, so that is on me. If you have any questions, I am available.
Thank you. Anything significant in this round of
No,
last
most of
minute?
the changes from last time were updating the statutes because the statutes were still old from the last time it was done, which was, I don't even know when, because some of the statutes were completely gone. So it was that kind of stuff. There are no substantial changes in the substance from what you had reviewed previously.
Thank you. And this did go to the Personnel Committee for review. I'll touch on that. Mike, why don't you start us out?
Hi, Mike Rubel, Director of Operations, and we are requesting for you to adopt the supplement and the handbook for use in 2025, retroactive to the first of the year. I won't restate everything the gentleman stated, but I am happy to take any questions that you may have on any of the content of the supplement or the handbook.
Could you give us 3 minutes of kind of a synopsis of our health or our Personnel Committee meeting of what you shared with us there, particularly regarding the process that this policy went through at the county commissioners and council levels?
Sure. So the process began about 3 years ago via the county council and the county commissioners. The handbooks that were, the old handbooks went back to the year 2000. There were some periodic updates, but for the most part, the subject matter was fairly old. So there was some need to do some updating over that time. The HR team that was in place 3 years ago began that process as sort of, I guess you could say, plodded along for a while. Approximately a year ago, when the most current version of the HR team was hired on, they started fast tracking that basically. So they made a lot more progress, and they were able to work extensively with the commissioners. They worked extensively with the county council. They also involved the different departments around the county in the process. There were several opportunities for feedback directly from those departments. Department heads were frequently involved in HR meetings, particularly over the late summer to fall, to flesh out what would be feedback that we could then, or not we, I should say the human resources could then take back to the council and to the commissioners for their feedback to come out with a final version of those policies. Probably, I think it's fair to say the policy or the part of the handbook that caused the most conversation was the PTO policy. That policy over several months went through multiple changes. And starting, I would say roughly in September, when HR was holding monthly meetings at that point to give departments feedback on what the feedback from the commissioners and the council, and then they were able to get large amounts of feedback that way back, but they also got a lot of individual feedback. So that was in the form of emails, telephone calls, people dropping in. I think it's fair to say Amy and I did all of the above with concerns, and those concerns that we had within our department were generated from staff, from directors, assistant directors, from the health officer, Dr. Purshotham. We tried to feed all that information back. Amy and I also, over that period of time, went through the handbook in its entirety. And at several points, there were several different pieces there that we wanted to have clarification on. HR was very good about addressing each and every one of our concerns. In large part, what they did was they moved towards the handbook that we had. So there were pieces, I'll just use the bereavement policy as an example. Our definition of affected relatives and where employees could be off, we had a broader definition. They actually adopted that definition for the entire county as they felt that that was more reasonable. So in our review, we found at several points that the county actually came towards our version of that. But we also wanted to be able to adopt those areas where there would be more positive movement for our own staff. And so but the one going back to the PTO policy, the PTO policy is a little bit different from the rest of the handbook in that the PTO policy is governed by the county council because they oversee all matters fiscal. That policy is considered a fiscal matter. So although today we are asking you to adopt the supplement in the handbook, the PTO policy and those pieces of the handbook related to it, which would include vacation, the vacation policy, personal time policy and sick time policy, those necessarily have to be adapted and adopted to fit the PTO policy, which we are following right now. So in essence, that was the creation of the policy. The supplement essentially does two things. Number one, it describes every area where we will deviate if there's substantial deviation from the HR policy. It also orients us to the board. So there are several matters in the handbook where the final authority are the commissioners. For us, our final authority is you. And so those pieces are noted in the supplement to orient us back to your authority.
Okay, thank you. Just for clarity, this item is to vote on our supplemental to it. No, whether there's old business item, can we merge them?
I would merge them, yes.
Okay. So we are discussing simultaneously both the supplemental and adopting the county's current 2025 county employee handbook.
Yeah, the supplemental doesn't do anything unless we adopt the handbook.
Okay. That makes sense. Relative to the Personnel Committee, we did meet on January 6th, I believe. As a committee, we went through both the supplemental ordinance and the county's new employee handbook and had a great deal of discussion about it. We talked about whether there, any possible changes or anything we could do to make it better for our staff and give Dr. Migliori more tools to attract and keep employees. And in the end, there wasn't much we could do, especially regarding the, this is county council has put a lot of effort into this and the decision of the policy. We recognize maybe there's, some items in there especially on the PTO that hard decisions that had to be made. And for me personally, I was convinced that the county council, along with the commissioners and all the department heads and staff, put a lot of effort into coming up with a good, the best balanced policies that they could, and considered all issues. And also, I was convinced that staff had opportunities in the public forum or even in one-on-one to comment and share their thoughts on the program. The Personnel Committee did vote unanimously to recommend to the board that you go ahead and adopt these two programs of the handbook and our supplemental policy. Is that fair for those others that were at the Personnel Committee?
Who is on the Personnel Committee again?
It was myself, Dr. Lindeman, this guy.
Got me already.
I did. Dr. Hayes and Ellen Landlander was there as well. It was the four of us. Dr. Migliori, anything to add? I assume you're still
No,
supporting?
yeah, I think that it's been covered and it's not an easy task, but it has to be done.
And I always like to ask our legal counsel, any we're good to go from your standpoint? It's a good program?
So I would just both together,
Okay.
so joint motion.
All right. Can I get a motion to adopt both these, both um,
Supplement in.
the
county.
2025 St. Joe County Employee Handbook adopted by the county council, as well as the St. Joe County Department of Health supplement to the St. Joe County Handbook?
So moved.
Second.
We have a motion and a second. Any further discussion or comment, question? No? Thank you. Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries.
Thank you.
Next item on the agenda, or there's, the next section is grant requests. We have none. Moving on to old business. Item 24-49, discussion and vote. Chapter, revisions to chapter 117 of the St. Joe County Food Establishment of the St. Joe County Code, as tabled. This was tabled from our last meeting. It's my understanding that we would like to table this one more time. So if we could get a,
So-
oh, go ahead.
Attorney Rylander's been ill. She wanted to review the changes. It actually is ready. I think you have the final form, but you have not had time to look at it. There have been changes to this that you may want to review. I think they're all good changes, but once again, it'd probably behoove you to take another month just in case there's any questions you have. You know, you feel free to reach out, we can clarify. There may be none, but the opportunity probably would be best.
I haven't had a chance to look at it.
I have a quick question.
Sure.
The changes that are made, do we have anything that shows like what we had and what we're changing? Like, you know how you have this, all the red line stuff, love that.
Yes,
Is there a way we can get that?
Jenny can send it to you, yes.
Easier to be like.
It is. Yeah.
Can I get a motion to table this item?
I make a motion to table the item 2449.
Thank you.
Second.
So a motion and a second. Any further discussion? So we will see this in a month. So all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Item 2450 has already been addressed. So the next section is public comment. Jenny, do we have no public comment? Okay, great. Next section, time and place of our next regular meeting will be February 19th, 2025, 4:30, here in the fourth floor council chambers.
Quick question.
Yes.
I thought we had to do the committees as well. Like we did the president, vice president. Is that not true?
Yeah, you can reestablish the committees. If you want any changes, you can make the changes, or you can just vote to keep them en masse.
I just thought, if we don't have to do that, it's fine. I just thought we did.
Should do it.
We should do that. Okay. Can I get a motion?
I make a motion to re-elect the committees in mass.
Second.
Thank you. We have a motion and a second. Any further discussion? All those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. All right. Next section is adjournment.
I make a motion to adjourn.
All right. So moved and we're adjourned.
Motion. You could just.